If you're a nurse in your first year of nursing, listen up. That first year of nursing is a doozy, and so I compiled a couple of tips and recommendations to help you be successful in your first year. These are some of the things that I find help make new nurses successful when they are first starting off. First and foremost, this new nurse crash course is phenomenal if you are a new nurse. I actually wrote this new nurse crash course specific for nurses in their first year of nursing. It gives you tips on how to prioritize, task management, how to talk to providers, how to give report, how to insert IVs, how to assess patients, how to know if your patient's crashing. All of the big scary things for new nurses is in this course. My next tip is to be open-minded to all the different techniques and ways that things are done. There's obviously policies and certain things that you need to do exactly in the correct order. However, I will say that there are a lot of little things here and there that you can pick up on from all the nurses, compile all that information in your brain, and then as you get more comfortable in your abilities, you're going to kind of form your own way of doing things. For example, let's say that one nurse recommends that you go assess your patient, then do their medications, then chart, and another nurse recommends that you assess all your patients, give all the medications, and then chart on all of them. Take all that information in, learn all the different ways and techniques and things, little tidbits here and there, and you'll form your own opinions and techniques. And soon enough, you'll be training other nurses to do that. My next tip, and this is probably not a common one that people recommend, is as much time as you spend learning at the bedside, learning at home, taking courses, invest that time also in yourself. So many nurses burn out in their first year, and it's not just because like it's overwhelming. Yes, it's overwhelming, but they take on so much and they do not prioritize their own mental health and self-care. So make sure you start doing that from the beginning. Trust me, it's going to pay off. My last tip is to take anything that you don't understand or that you want to look up or learn about, write it down and have like a running list of things that you kind of look up when you have some free time. So that way you're constantly learning and growing. And even if you're not able to look something up in the moment, it's still in your brain for you to look up later. So that way you constantly can build upon your skills and become an even better nurse. This first year is a doozy, and it's just kind of like a trial by fire. You just have to kind of jump right in and you're going to feel better a year from now. So let me know if you have any other tips or have any questions.